Welcome back to Clicks and Coffee. Today we're joined by Christina Buchanan, the founder and CEO of Trinity Rehabilitation and Wellness in Cary, North Carolina, right outside Raleigh. With over 20 years of experience as a speech-language pathologist, Christina specializes in adult and geriatric care, focusing on cognitive communication disorders and neurodegenerative disease like dementia. Her dedication to patient-centered integrative therapies has made Trinity a trusted resource for enhancing communication and physical abilities. Christina, welcome.
Thank you, Alexander. Thanks for having me today.
So, one of the things that is always pretty exciting, I would say, when you work in the senior industry is that everybody is doing it out of passion. And so we were just talking about that you need to love what you do to do it well. And so I would like to know what inspired you to establish Trinity Rehabilitation and Wellness, and how has your vision evolved since you started? I think it was in 2020, right?
Yeah, we actually started boots on ground. I will call it our designated time frame, which was, of course, during COVID. So this was a very interesting time frame, obviously, to start a company and to take that big leap that many people were very afraid to do. And like myself, I was very afraid to begin something big like this. I've always wanted to start either my own business or fully invest myself back into medical school. So there were kind of like a two-part plan in my life where I said, I'm either going to start my own company or jump back into the medical kind of schooling area and go get my either doctorate or PhD in medicine. And I said, I really love doing what I do as a speech language pathologist, especially in the medical field, because a medical speech pathologist is very different from a school age speech pathologist, just a general practitioner in the outpatient. I'm very specific and focused on the neurodegenerative population, dementia, Parkinson's disease, neurodegenerative disease, and the aging person. And so when I go to aging person and I talk about that very passionately, is that this doesn't just include the older geriatric population, includes everybody in that sphere. And that even includes me and you. So we are all aging. We are all getting older. Nobody's getting younger. So that sphere and that kind of broadband, of people have really inspired me to start my own company, to not just help my patients, but to help their families too. So I decided on the idea and the concept of Trinity because it kind of unifies all of the areas of rehab, wellness, and advocacy, which is the triad of what I've developed it on. Which has transformed my vision, has really helped me focus on the rehabilitation component as a wellness component. And yes, of course, we go through insurance and we bill for our specific services, but then we also provide other aspects of care, such as symposiums and education, support groups. We provide exercise classes that incorporate the brain and the body. So we've really honed in these last couple years on Trinity Rehab and Wellness as a wellness and an incorporative rehab model. And it has just exploded. It has been really wonderful. And we are still gaining traction and growing with our clinicians and adding more individuals to our company, adding more also resources and colleagues of mine who are in different areas like this, who really want to better patient health, also better family health. Which has inspired me to do some other things that we can talk about down the road. But this is exciting. And so it initially was Trinity Speech Therapy, and then we've expanded to Trinity Rehab and Wellness because I thought, I can do speech therapy really well, and I'm learning still to do things even better. But now we can really add the model of the other two disciplines, physical therapy, occupational therapy, that's the rehab side, and then the wellness component, which I can really showcase now as I've been more confident in giving educational talks and symposiums. I've been asked to speak in many dimensions around the area, and I'm about to get into something even bigger, which, like I said, we'll highlight shortly, which is going to just launch my speaking career as well. So I'm excited for all these amazing things that are going on, but I'm excited to even more so grow a team of people who truly care, who are compassionate, and who really love helping our older population and even their families age best. So
pretty impressive, impressive start. And so, um, so you're talking about, all this range of therapy, and how do these integrative approaches benefit patients with neurodegenerative disease like dementia?
yeah, sure. So, I truly believe in a team approach when it comes to treating the whole person. Not one clinician alone can do it all. So even me, I'm very diverse in what I do, but I truly believe in adding the different layers and components of clinical care that help the patient adapt in the disease process better. So when we add, for instance, physical therapy and occupational therapy to the mix, we really treat the whole person. I've had patients, and I've learned this even more so when I practiced in COVID, where they couldn't see other therapists because other therapists weren't coming out to go see them. I developed this model where I could go to the patient's senior living facilities and treat them in their homes, but I saw so much more going on than just cognitive communication decline. There were physical issues. There were issues with their activities of daily living that needed the PTs and the OTs to really hone in and address. So I said, I need to add more to my brand and to my business and to my care, ultimately, to help these people do life better and to participate in their own lives with better quality of life. So,
Yeah, because a lot of the time we focus on, like, this is what I do. I'm focusing on
right,
this, and then no, this guy is going to focus on this, and then he will figure it out. But you try to come up with a, and so you were talking about also wellness, and I know that it's really becoming a big thing,
yes,
of, instead of being reactive, which we have to be, because that's
right,
sometimes you have to be, but also to be proactive, and really try to help people before
yeah,
it gets problematic. And
right.
so, can you tell us a little bit about what you do, since you said that you were getting more and more comfortable in coming up
Yes.
with
No, I love what you're talking
Mhm.
about. And in one of my aging symposiums that I do in a presentation format in front of higher level functioning patients who are in the independent living, area and or some of their even family members. In this aging brain series that I present on, one of the topics is prevention is intervention. And you just said it right there, Alexander. You highlighted that one of the biggest things that we have to realize as healthcare prevention or healthcare professionals is that prevention is the beginnings of a better road to intervention. We have to start early and catch these issues before they tumbleweed into something greater and bigger, into deficits that could be hard to bring them back to a baseline. So as a clinician, I do the very best I can, and so does my team, to create a new baseline and try to improve where we are within that kind of frame of phase, right? So patients in a certain phase of dementia or phase of their Parkinson's, and we do what we can to help them within that phase. That doesn't mean that phase is going to stay still. They're going to change. The person's going to change. And so we just help redevelop those new baselines, but also help them stay, and as much as we can, help them maintain skills where they are. And if we can really, as clinicians, good healthcare professionals, really targeted healthcare professionals that see these changes happening and that can foresee a bigger change and work to prevent that, we are so much better as a group of medical practitioners to help these people, provide them the best quality of life, and hopefully get ahead of the great fall or the great decline, so to say.
Yeah,
So
yeah, no, for sure. And so I know um, telehealth is becoming increasingly, I would say, important in healthcare. And I saw a couple of new companies. I don't remember the name, but it was like to help with pills. So for aging parents, it like distribute the pills, but also you could meet with your doctor through the
right,
same device. So telehealth.
that's
So
amazing. Yeah,
yeah, it's like they come up with so many ideas. And actually, I tried it even for myself the other day. because I'm like you, an entrepreneur, super busy, and sometimes I don't want to go to doctor or like spend a couple of hours to take that off my day. And
Really?
I
Yeah.
started, and it was interesting, I would say, but I really like it because I was at the office. I did my yearly checkup, and we managed to do that all by Zoom, which was pretty mind blowing. But how is Trinity adapting, and
Yeah.
like what is your vision on telehealth, and in specifically in your field of activity?
Sure. So I actually do telehealth myself. I'm the only clinician currently that does it. So part of like the senior living side, if the patient, can't be seen in person, they can access me through the telehealth component. And we have a telehealth portal as part of our EMR, which is fantastic too. So our EHR EMR program has a telehealth component. So it's safe, it's HIPAA protective, but also, um, these individuals absolutely benefit from that, from these check-ins, from our weekly meetings. Even if we can't see them in person, we can see them through telehealth for sure. And that just kind of closes the loop of care. It kind of brings full care. As a provider that provides telehealth, we actually provide a lot more than just that. We can notice things on telehealth that perhaps our doctors are not always seeing, and we can go ahead and refer them to their physicians and or to an outside provider like a neurologist and say, like, this patient really has experienced a big decline. I like to touch in with a lot of my outpatient folks who I see in the community through telehealth. And I do have actually a telehealth business for at least the speech patients with me. Aside from our senior living component. As a matter of fact, I have a client that's right after you. I'll be seeing them through telehealth, and it just works better for them because of distance and travel. And, some of them live in Wake Forest, which if you reference that to Raleigh, it's quite a distance. It's about 45 minutes away from Cary. So it's not convenient for a person with dementia or Parkinson's always to travel. Travel also brings on a lot of anxiety for patients.
Yep.
It brings on a lot of, difficult mental health and or physical components to persons with behavior issues when they have dementia. So we try to limit that. If we can see them in person or if we can do telehealth, that is really kind of the best route. And I can determine that within our first couple of sessions with the family members, what would be their best route, whether it's in person at the facility or in telehealth. So
you're a big advocate for telehealth.
I would say I'm a pretty big advocate for telehealth. I still think the in-person for the individuals who need that is great, but I do think that because telehealth has opened up so much more opportunity, it gives the person who cannot travel and the person who also struggles with the physical component to come and see us regardless. And
and
I've
have the like the
mastered
person
skills
at
on
the
that level too because of COVID. COVID forced us into that, Alexander. It forced
yeah.
us into doing a lot of this virtually. And so now we become better Zoomers, better podcasters, better speakers. And we've also been able to captivate our audiences a little bit better if we've really worked on ourselves and our own skills. Because let me tell you, it's a totally different platform, right? Like when you're in person with someone than being virtually, and keeping their attention long enough to keep them moving through exercises is also another challenge as a clinician.
Yeah.
But it's amazing how much training that you go through. And I went through a few training classes for it to help me become a better clinician virtually. So yeah, we
And then
do it.
yeah, and on the patient side, it's strange too, because the first time that I did the telehealth, I'm so used to do meetings that I, call people by their first name. So at the end of the call, instead of saying, have a good day, doctor, I said like, have a good day, Bob. And then the doctor looked at me, and I was like, oh, I'm so sorry. I'm so sorry. That
Because
was
their
like,
name is on the corner, right? And you're
yeah,
just
yeah,
seeing, yeah,
yeah.
it's so true. Yeah.
That was pretty funny.
But perhaps it's brought another level of comfort because some people are also not as comfortable in person, another level or another layer of comfort because I'm not physically in this person's, realm. So now I can feel more comfortable and some people just feel more comfortable that way too. So I do have it as an option if the person can access it. The caveat to that is some people cannot access their communication device, their computers as well, because I'm dealing with an older population. But I do have some clients in their 60s and 70s who can use it very well.
Yeah. And that is every year is going to get better, I would say, for everyone.
Yeah.
Just
Right.
getting used to it, and it's just going to become natural, I would say, in a couple
It
of
really
years.
will. It really will. And telehealth is a game changer. It has changed the way that we do healthcare if we can do it well under that platform. So yeah, I
Yeah,
agree with you. It's opened up doors.
for sure. And so, what advice would you give to families seeking rehabilitation services for their loved one, particularly when navigating the complexities of, dementia, for example?
Dementia, neurodegenerative disease, whatever that looks like, right? So some advice that I could give some family members, and I would say, this kind of goes back to some of the things I tell my clinicians and things that I tell myself often. And so it's know what you know and know what you don't know. Because if you don't know something, it's okay. And I want people to feel more and more comfortable knowing what they don't know and then finding out what you need for resources to fill in those gaps. We're looking at the world of aging as a huge puzzle piece, right? And we have all these different pieces that fit into the puzzle, and we have a lot of odd sides, right? We have a lot of change. And with the shift, in how we see healthcare now and what we're doing for it, we can adapt some of those pieces and try to complete this puzzle in a much more, I feel like, all-inclusive, holistic way, and providing resources. So I say navigate this journey with an open mind, and also navigate this journey with people in your sphere. I would say that building a care team is one of the most critical components in helping a person and a family member, creating a team around you before things get worse. Identify and look at what's happening with your body. Okay, I'm noticing I'm forgetting things. I'm noticing my balance isn't so great. I'm noticing that I'm not remembering the daily routine that I used to do. And that's the scary point. And as healthcare practitioners, we need to help people through the scary. We need to help people through the anxiety. And that comes with training. That comes with really understanding the disease. And if we understand as clinicians the disease better, we can help these families navigate and build a true care team. One of the things that I'm doing right now is designing a model for this. And I'm at the very beginning stages of it. I'm not going to give away all the tidbits because some of it's a secret, as you know. You're privy to all these secrets. Alexander, you're gaining all this inside access to people. So now there's a bigger component coming out there where with another colleague, we're designing something really special that's going to be a game changer for senior living industries. I'm excited to pilot that at some point.
I hope you're going to call me when it's ready, and then
Yes,
we can
will
we
do.
can talk
We'll
about
come
it.
back on and talk about this very neat model. But building your care team is critical. In my book that I'm about to showcase, we are just starting the book. We're just beginning the writers and authors meet and greet pretty soon, but we're about to really develop some interesting, groundbreaking components and tools, which I'm looking forward to featuring that as well. And that is coming out. And one of the things I love to highlight, not just in the book, but in a lot of my symposiums now, is how you develop this critical care team. It's a critical care team. It's a team that cares about you, knows you specifically, knows mom, knows dad, knows the family member, knows the caregiver involved, and becomes your best advocate. And however you develop that and however you seek your resources is going to play a major role in how you develop a personnel around you to help you keep things under control, as much as in control as we possibly can, right? And help that family, that person, maintain a quality of life, because it's not just the individual, it's the family members too. We talk about caregiver burnout a lot and how people burn out because they're caring constantly and they have no help no support. So this goes for the patient who's experiencing the disease along with the family member. And so my biggest piece of advice is create your care team wisely and know your resources around you.
No, that's pretty good, and yeah, at least that's going to help because I know for example my grandfather is a little bit in that case. Luckily, we have two people because he still wants to stay home,
Right.
and
Most of them,
so
and most of them, if not all of them, do. They still want to stay where they are, and we can do that successfully. We
yeah,
can do
yeah,
that successfully when we have, and like you said, you have family and you have people, but when that gets difficult, having professionals in your sphere are just going to make it much better. For
yeah,
not
yeah.
just, then you can become the family member you want to be. You can become that person where you just go to visit, and spend that time where it doesn't just become all about that burden of care. It becomes like, I can
Exactly.
actually take grandpa out and take him for dinner and just bring him home. Like, and what,
And have professionals taking care in a professional way, trying or instead of trying to make it work.
right. And then you're running against this whole personal dilemma of like, am I spending enough time with them, even though you're spending all of your time with them, right? Because I do believe the heart speaks to the mind too, in that way. And, sometimes you feel like your time is so strained, and to remove that strain and to de-stress with bringing more people in just helps you spend better quality of time, and helps patients and family members feel like they're having family time again, which is critical, because we never know when those days are done, and we want to live our best life with them, and we want them to live their best life with us.
For
So
sure.
yeah.
And so looking ahead, we talked about starting in 2020,
Yeah.
having a pretty crazy growth. What are your goals, and how do you envision the future of Trinity Rehabilitation and Wellness? So we know we're going to have a book, going to have a special tool, secret, that we're all excited.
Yeah.
And how do you see your expansion and the future of the company?
Yeah, I definitely envision growing in senior living and expanding our teams in those areas, as we're really just at the beginning phases of the Trinity Rehab and Wellness side of this. But I know that we have such a critical mood point in all of this industry. It's exploding now. We're exploding with it, with other companies, and I've had so many engagements in the last few weeks just with other smaller businesses trying to understand like how we did what we did. And I said, look, I'm a forever learner. I'm not perfect. I don't do everything perfect. So I'm learning from, trial and error sometimes with just business ownership. But being a servant leader, I think is going to continue to be a critical piece of the vision. Learning how my teams are working, learning how to help my teams work better, learning this growth point as in like, okay, I need people that are here to work and to have the same passion. So hiring for that is going to be a big component, which means I'm hiring slow, which is okay, because I'm looking for personality qualities that are going to bring out the best in the mission and the vision of the company. Um, and then I'm hoping to really, expand not only just senior living, but perhaps someday we will have a clinic, an outpatient community clinic that will tie all of this in. And that's another big, secret to the sauce here, because bringing all of our skills into the community on an outpatient level and then bringing it back into senior living, like almost 360 degrees of care, is a big component that I'm going to be exploring in the next 5 to 10 years. So that's really what I envision for the company and potential franchisement, of that. So without giving all those deets away, but yeah, I want to expand, not just in a senior living position, but outside of that, and help our community, people who are aging in their homes, even more. So yeah.
That's pretty exciting. Pretty exciting road ahead. And so if you have one advice, I'd say, like, let's not go into. I know that there are more to it, but one quick advice to anybody today as they are aging that you see people not doing and that they should be doing, what would that be?
Become your own advocate. Learn how to become your own health advocate, especially in the early stages of aging. And that means like 50s and 60s. Learn the tools now to become your best health advocate and educate your children on that. So then they can become the best advocates. Like, see, I believe that this is also generational. We can pass this idea along and this best quality of life mission on to generations after us. Because if we can care for ourselves better, creating our care teams, creating our building our repertoire and our professionals, and building our own knowledge about this and how to do this, having our own bank of resources ready to go. So our children and their children will know how to age better and better and
So
better.
let's not try to do the ostrich, and let's try to face, what could be the reality, and,
What
and
could
be
be the
ready.
reality? That includes like identifying markers of dementia early on. There's all kinds of ways. There's blood work. There's all kinds of things. There are going to be new ways to also explore getting treatment for Alzheimer's and dementia. I work for a nonprofit as well. And we actually help one of the local labs in one of the college universities. And I heard so much recently about what they're doing to help with I would say, a fast track to rewinding age on people who have dementia, and to almost remove some of these issues that people are having, these symptoms, which is going to be incredible.
That
So they're
sounds
the
pretty exciting.
very, very beginnings of this, but this is going to be groundbreaking. And it's going to be game changing. It doesn't mean that other things can't happen, like strokes and brain injuries and other areas, but we are really looking at ways to um, defeat this
Mm.
disease one step at a time. And
Oh,
right now, we don't have that. And so, what we need is the care professionals aligned to help come beside these people, and people who are compassionate, who can give you honest and valued and sincere advice, or who you want in your circle. You have your family circle, your friend circle, and now you need your aging care professional circle. And I think that will help you age better.
wow. No, it's fascinating. That was really a very eye-opening, I would say, episode today. Learned a lot, and even though I'm pretty young to get ready, but I think I'm gonna start learning more about it. And
Learn
and
more. Yeah.
and
And
as you
then,
said, like, let's not try to be the ostrich, and the earlier the better.
yeah, it's like we're calling out the elephant in the room, and yet we're developing tools around it. So this elephant might shrink a little bit. He might not be so much of a, mommy
That's
elephant, but maybe it's a baby elephant we're dealing with. That's a lot easier to deal with than a gigantic daddy or mommy elephant. How to explain this to my son who's 8. He's like, "Mom, that's really interesting." He's all about it.
understandable.
What also has been really special is my family has been involved in coming to a lot of our aging symposium. I feel like adding children to the picture just helps our aging population just love their life even more. So my son will come to some of these presentations, and he'll help and make announcements on some of the raffles that we have, and he
Oh,
loves it.
that's
So
nice,
train them up in the way they should go, and
for sure.
they will do exactly what we need them to do. So when we get to that age, they know how to be and how they can age best as well. So it hopefully will change generations. These ideas, along with this amazing research coming into our sphere, that will hopefully change the disease itself. So, yeah.
Pretty exciting. So, folks, if you are in the Raleigh area and you have questions about anything related to rehabilitation, speech, feel free to reach out to Christina and learn and prepare yourself. Christina, it was a true pleasure having you, and wish you all the best. And I'm expecting you to call me back when the book is ready, and then when that
Yeah.
secret project is
So
ready as well.
I would love to maybe even connect our author group, because it's a collaboration authorship. It's not just my book. Debbie's actually the leader on it, but I'll be able to give more details about that as we get going. But we're starting very soon. April is our start date for our collaboration with the authors. So I'm so excited to get this information out and highlight this book. It is truly going to be a gift and a tool for so many out there. So stay tuned.
Very excited. Thank you, Christina.
Thanks again.